Hello, thank you for joining our Act at Home about the concerns with Enbridge doing some of their pre-construction work in the middle of this COVID-19 crisis. My name is Elizabeth Ward. I'm the director of the statewide branch of the Sierra Club. And we are going to be talking today about those concerns. In case this is your first Act at Home, we're doing these every Monday, Wednesday, and Fridays. They're 15-minute chats. We're calling them virtual chats or coffee breaks in case you want to break from what you're doing for the day. On Mondays, we talk about an issue that we're working on or concerns like we're doing today. On Wednesdays, it's usually something fun, and Fridays, it's kind of anything in between. So today we'll be talking about this on Wednesdays, and this Wednesday we'll be doing birding 101 in case you've been looking outside your window and want to know how to identify the birds. And on Friday we'll be talking about cooking from your cupboard. So I hope you can join us for those. And I'm going to turn it over. First, we'll do introductions with our three speakers today, and then Jan will kick us off. So first, for introductions, Jan.
Okay, hi everyone. I'm Jan, and I'm from Highbridge, Wisconsin, which is in the heart of Ashland County, up along Lake Superior, in the Bad River watershed. And we are landowners. We have 40 acres on the proposed pipeline, and we live on Billy Creek.
Thank you. And Sheila, do you want to unmute yourself and introduce yourself?
Hi, my name's Sheila Mitchell. I live in Ashland, Wisconsin, up at the very top, and on Lake Superior. I'm involved with this project because I'm in the League of Women Voters and on our Natural Resources Committee. And I have an interest in coronavirus because I am a retired emergency room physician, long retired, although my husband is presently working as a physician up here in the community.
Great. And Phyllis?
Sorry, I was unprepared. Yes, I'm Phyllis Hasbrook, and I'm part of the tar sands team that Sierra Club is part of, and I work as an organizer with landowners and communities around the state fighting pipelines, including the Line 5 reroute.
Great, thank you. And before I kick it over to Jan to kick us off, if this is the first you're hearing of the Line 5 pipeline, we'll put in the comments and encourage you to check out the recording of the virtual chat that Phyllis, Murillo, and a couple other members of our tar sands team had introducing people to the topic of Line 5. But for now, I'll kick it over to you, Jan, if you want to describe what's going on and some of the concerns.
Okay, I was just disconnected. Our internet up here is extremely slow. But we have a huge number of very bright, concerned neighbors. I also am involved with League of Women Voters Natural Resources in our local chapter, and have been well educated over the years as a backyard environmentalist on issues of advocacy. The pipeline running through the watershed is just unacceptable. If any of you have been here, you know it's a pretty amazing place on Lake Superior. And we are connected by water, the Copper Falls Aquifer, and a lot of streams coming from the Pinocchio Mountains down to the Bad River and out to Lake Superior. We began seeing the neighbors in Highbridge and over toward Gurney, up in Iron County, activity roughly the first week of March, and identified it by virtue of a neighbor going over and talking with the workers that they were well drillers doing eco-technical drills, which are part of preliminary to the permitting process. These wells are testing soil and water types in the various areas along the proposed pipeline. Well, this got us all quite concerned because water is a huge issue up here. Our water quality is important, and our streams and aquifer are extremely important. And so neighbors started to call each other and began taking pictures. And then COVID, the governor's executive order came into force, and we really began to question what these people from out of state were doing in our area working. We had documented workers and companies, these are contracted employees for Enbridge, coming in to drill from Colorado, Utah, out west, and Minnesota, but they were coming in, are using our local hotels and takeout restaurants and gas stations, get grocery stores, and no comment from Enbridge as to their activity or to any type of program they had going in terms of testing the employees who were coming in from out of state. I'm a retired nurse practitioner, and also my first job up here was as a public health nurse in Ashland County. So doing due diligence and following the course of things that I've learned with working with the league, began making phone calls to our health department, who I know quite well, the sheriff's department in Ashland County. I contacted our senator and representative and tried to figure out what was going on. And we also have a neighbor who's a retired DNR hydrogeologist who went out and met actually with some of the well drillers along the line. He has worked with them before. The first thing we found was that what they're doing is correct according to the rules of the DNR in terms of drilling these wells. They're drilling them, properly, and at least that's what we're being told, and capping them properly. But we still have concern as they're hitting water, they're hitting overflowing wells and springs in their process. So we're still concerned about that. But nonetheless, this COVID issue brought to question what these people were doing. This is not an established pipeline. It's not carrying any product, and because it's not there, it's preliminary work. And so our senator's office contacted the health department and the governor's office, and also it's another agency that deals in Wisconsin with corporate economic development, I should say. And the lawyers on all those told us that according to the governor's orders, they technically could be included. But what was disturbing is Husky, who's another tar sands company out of Alberta, Canada, is rebuilding a plant where there was an explosion in Superior a couple of years ago. And as soon as the executive order came out, they canceled or postponed any construction, concerned for their workers and also who are contracted workers, some from out of state, and concerned for their workers and also for the community. Enbridge has shown no consideration at all for the people of this region, and has given us no explanation to why they have not followed what a fellow tar sands company, Husky, has done, and done quite appropriately, and that's to close the operation until the COVID pandemic restrictions are lifted. I have written a letter that's appeared in some of our local papers and on the social media, explaining this and just asking, Husky for some sort of responsible action and to get these people back to their homes in Minnesota and out west. And that's kind of what's happened. Sheila will take it over from here.
Thanks, Jen. And Sheila, oh, great. You figured out how to get off mute.
Yes, okay. So this is Sheila. I thought I would just talk a little bit about coronavirus before heading into why it's a problem in our area. In general, I think people know that the numbers in the United States are staggering. We are almost up to 1 million cases, confirmed cases of COVID-19, and almost up to 55,000 deaths from that. In the world, there's 3 million cases. So in other words, we have 1/3 of the cases within the entire world at the moment, with 210,000 worldwide. Basically, what the World Health Organization has attempted to do is telling the world that they need to watch their infection trajectory, which is basically watching a curve to see where we fit in that. And unfortunately, the United States has the worst infection trajectory, with us not bending our curve, but starting to bend our curve, thankfully. We have done some wonderful things since the middle of March. Number one, while listening to the World Health Organization, we are not going across the world on airplanes anymore. And at the moment, because of Ever's stay-at-home order, in the state of Wisconsin, we have been keeping people at bay to help our own states. So in general, even though things look pretty bad for the United States, there have been measures that have been put into place to try and help things out. So it's not all bad, but it could be an awful lot better. As far as Wisconsin is concerned, our cases in Wisconsin are at 6,000, and we are still rising. So Wisconsin still needs to be minding itself. Our death rate so far is 281. 61% of the people are white, 34% are black, many more blacks than should. So the ethnicity situation is, of course, upsetting. Here in Ashland, up in our area, we've had only 2 cases that have been confirmed. In Bayfield County, there have been 3 cases confirmed, of which there has been 1 death. In Iron County, there have been only 2 confirmed cases, and 1 has died. The problem with that is that when you look at the case fatality rate, if you take the 3 people out in Bayfield, 1/3 of those have died, you've got a case fatality rate of 33%. Iron County, 2 people, 1 died, you've got a 50% case fatality rate, which looks pretty upsetting for us. I'd like to tell you what we have locally as far as resources. We have basically our area that goes into our local Memorial Medical Health Center. Our whole area basically encompasses about 40,000 people. Even though Ashland is only a city of 9,000, about 40,000 people feed in from Ashland, Bayfield, and Iron counties. Memorial Medical Center is a critical access hospital, which basically means that because of being that sort of a hospital, it has limited number of beds. I think it's 23. It also has a small intensive care unit with only 4 beds in that. There are some clinics. We have 2 main clinics, the Essentia Clinic and St. Luke's Clinic. We have a very limited public health system in the counties. We do have a community health center, the Lakes Community Health System, and we do have an emergency medical system, which do have paramedics in Ashland who would feed, of course, into those systems. I would like to say that for the local crowd, our area has attempted to set up, and I know this because my husband was a part of this. In mid-March, we recognized that we would be extremely vulnerable, and for that reason, the hospital got together with by the way, our area feeds into Duluth mostly. So people that get sick in our area basically are transferred either from St. Luke's or from Essentia, and they go into those systems, and those systems basically are fed into the Duluth healthcare system. It's either St. Luke's or Essentia Health up there. And recognizing earlier on that we would be in a lot of difficulty, they started setting up a triage system of levels of what they would do at which level, and how the physicians and the nursing care would start to handle this if they actually started to have too many people coming into the system. So I'd like to say that they have attempted to figure all of that out. And so they've got 3 different levels already set up, working with infectious disease and also intensive care within this area. And one of the reasons for that is because we would very easily become overwhelmed very quickly. So I'll talk now about our problems. As you may know, coronavirus, 80% of the people that get coronavirus, of that 80%, 25% have absolutely no idea they even have the infection. They are going around and they are transmitting it to other people. The other crowd get a mild infection and it probably won't even keep them at home. However, of that final 20% of people, 10% of them will go into hospital, will maybe need some oxygen and will be okay. But the following 10% will be phenomenally critically ill. Those people come down with something called acute respiratory distress syndrome, in which case they implode and need to go immediately onto a ventilator. And that has been the severe situation where a hospital will immediately become overwhelmed because it needs a lot of intensive care beds. Because each one of those patients that develops ARDS needs a ventilator. So I was just telling you the breakdown of the coronavirus patient. We have the same problem. So we have a limited number of ventilators here. We only have 4 standard ventilators, and those are intensive care unit ventilators. We do have some surgical ventilators where you could put somebody on for a very limited period of time, and those are anesthesia ventilators. It might buy somebody some time before you get that standard for one of the 4 ventilators, or until you can get this patient transferred out of our area. Besides all of that, we are having the exact same problems as everybody else. We have very limited PPE, or personal protective equipment. Both the hospital and the clinics are having a problem with that, and the entire state and nation is having that problem. We aren't any different than anybody else. We are having a lack of testing. We can test very few people, only those that are getting admitted. Other people are being sent home to quarantine. The ones that are being admitted into the hospital, they are being isolated just like they are in other hospitals. Yeah, so, and others that are extremely sick, if we can get them, we get them out of here immediately and get them to a higher level of care. So basically, in a nutshell, we are ill prepared in our area, just like most of rural America, to be able to take care of this 10% of people that come down with coronavirus in our area. We're not a lot different than other areas. Most areas aren't ready for this, but rural America is specifically not ready for this. And we have, so at any rate, I just letting you know that we kind of join all of rural America in being a bit of a pickle, and we're hoping for the best. I think the stay-at-home order has been wonderful. We need to keep that up, and hopefully we will get more testing. By the way, we're not sure our tests that we're even doing is accurate. So we need more PPE, we need better testing. We obviously need a good triage system to get people out of here once they get sick. But the main thing that needs to be continued at the moment is to keep people safe at home, and people respecting those orders, and wear your mask when you're outside. So, thank you.
Thanks, Sheila. That's super important information. I am going to now turn it over to Phyllis to talk about what we can do.
Okay, and if everybody else can mute, we got a little bit of echo there. Now, can you hear me? Nod your head. Yes? Yes, good. Elizabeth, were you going to share that petition? do that if you can. So we have a petition calling on the governor to say that the Enbridge workers, that the contractors for Enbridge should not be allowed to work right now during the COVID crisis. And she's showing us the page here. And it's calling on him to say these are not essential workers, as indeed they are not. They are not bringing fuel to anyone. They are trying to get ready to build a new pipeline. So it's brand new, this petition. That's why you'll see it says 0 messages of 500 goal. That's because it's just going up today. And so let's see how many we can get. When you who are watching this on YouTube or Facebook, please share the petition with your friends. Sign it yourself first and then share it with your friends. If you can do a little more than that, write a letter to the editor. And these can be very short. As a matter of fact, they can't be very long. It's usually 200 or 250 words that a newspaper allows. You can find that online where to send it to for your newspaper, and just do a simple one using some of the facts you've learned here. And then also, if you are seeing this on Facebook or YouTube, message us if you'd like to get more involved with the tar sands team to help stop line 5. So I think we're just about at time. Thank you very much for watching this, and please help us stop line 5.
Great. If anybody wants to ask any questions right away, we can put it in you can enter it in the comments. Put the link in there. Doesn't look like it. So thank you everyone again for joining. We hope you can join us. You'll at the same link on Wednesday for Birding 101 and on Friday for Cooking from Your Cupboard. Or you can see those videos online as well. So thanks again and have a great day.